impetus for this play came because I'm a journalist. I'm not a nurse, I'm not a doctor, I'm not a healthcare professional. I define myself sometimes as a PP or an SP, a potential patient or a sometimes patient, which I think we all are. And when I went to work writing my first book about the healthcare system and nursing, I went into the hospital, and the very first thing I noticed, and this was about 28 years ago, was how poorly people communicated. Doctors didn't talk to each other, doctors and nurses didn't talk to each other. There was a lot of discussion of the team, but very little infrastructure for teamwork. And it seemed to me that people were essentially intimate strangers engaged at parallel play at the bedside. And it became very clear that this was a real problem for patients, and increasingly the studies about patient safety documented that more than 75% of medical errors and injuries are due not to people being stupid or incompetent or technically unproficient, but due to failures in teamwork and communication. And I became very interested in that, and it became clear to me that we needed to talk about that, but also it became clear to me that just sort of lecturing at people wasn't a good idea. And it occurred to me that to do a play, incorporating a lot of things that I'd observed, a lot of things that people said, was the way to go. And so I recruited a playwright, Lisa Hayes, and we wrote this play called Bedside Manners, which focuses a lot on doctors and nurses, but also other members of the team, and can be used to include all kinds of members of the team, and has been produced in hospitals and nursing and medical schools and so forth, where you include everybody. The trick here is not to do the play with professional actors. We started out with 4 professional actors who enacted I think it's like 30 roles or something, and that's okay. But it's so much better if you have maybe a couple professional actors who at least know what they're doing, and then you get people in the institution, at the conference, being in the play, and you rehearse them for an hour, 2 hours if you can, and then you put them up on stage and they read from the script, and they basically are the people in the play. And it's very useful to get doctors to play nurses, nurses to play pharmacists, OTs to play PTs, PTs to play chaplains, so you mix it up a bit, and you get people to see things from the perspective of people who maybe they're not sure about what the other person does. Maybe they think they know about what the other person does and the pressures they're under, but usually they don't. It's been surprisingly wonderful. I feel like I had a kid, and the kid is off on its own, and I'm sort of stunned that the kid is doing so well, because it's sort of the baby of Lisa Hayes and me, but it has its own life. And we found that it's very, very useful as a tool to initiate conversations about things that are kind of threatening in a way that's fun. We performed the play a couple weeks ago in a hospital in Colorado, and we had a doctor come up to us after the session. We did the play, and then we did a workshop. And she said, I dreaded coming to this. I hate touchy-feely things, and this was so much fun. And yet there were a lot of heavy things that were discussed about how people treat each other, but it was done in a way that I think kind of opened people up rather than getting them defensive. I think it's changing very slowly, too slowly, from the point of view of teamwork and communication and patient safety. One of the things in the play is that we show very vividly the places where people get into trouble. And often what we do and encourage people to do when they do the play is to take a scene where it didn't go well and redo it so it comes out well. And you discover that some really quick thing that took like 2 seconds can change a dynamic that ended in a case that took years of people's time.